Hello everyone. Today we are going to talk about fibroids. Now what are fibroids? Fibroids are non-cancerous tumors of the uterus. They usually occur in the reproductive age group of the women. That means they can occur between the menarche and menopause. After menopause, the size of the fibroids usually shrinks because of the absence of estrogens. Now fibroids can vary in size, number and location. That means they can be as small as 1 centimeter or they can be really huge, covering your whole tummy. They can be just maybe one solitary fibroid or they can be very many number of fibroids. As far as location is concerned, fibroids can be submucosal. Submucosal means they are in the cavity of the uterus, or they can be intramural like this one. That means it is in the wall of the uterus. Or they can be subserosal. That means they are outside the uterus, sitting right on the top of the uterus. Or they can be cervical fibroids. That is, they are not in the body of the uterus, but they are in the cervix. Or they can be broad ligament fibroids, which means they are a part of the uterus, but they are in the adjacent structure. So not all fibroids cause symptoms. For most part, fibroids are discovered as a surprise finding during a check scan. However, fibroids can cause symptoms and some of them can be debilitating. In some patients, they cause heavy menstrual bleeding and the flow can really be bad. They can cause dysmenorrhea. That means you can have severe pain during your periods. They can press on the bladder and cause frequent urination. Or they can press posteriorly on the rectum and cause severe constipation. Fibroids can also cause infertility. Remember, not all fibroids cause infertility, but some fibroids, due to its location and size, can cause infertility. Now, sometimes the only complaint of the patient is pelvic pain or pressure. They are actually unaware of a huge fibroid sitting in the tummy and they constantly feel that there is a dragging sensation down towards the pelvis. Sometimes there is a big mass in the abdomen. That means when the patient comes for a checkup, you suddenly see that there is a tumor lying in the. Now, the most common question people ask is, why do I have fibroids? We really do not know the reason of why fibroids occur, but we do know that it is more common in certain races. Like in Africans, fibroids are really common. Fibroids is also known to have some genetic association, and we know the first degree relatives of a patient is 2.5 times more likely to have fibroids. Also, they are more common in Nulliparous women. That means if you have never had a baby, then you are at a higher risk for having fibroids. Obesity is also known to be associated with fibroids. That means if you have more weight, you have more fat cells, and since fat cells store the estrogen and fibroids are estrogen dependent tumors, you are more likely to have a fibroid. We also know that fibroids are estrogen sensitive. That means whenever there is a increase in the estrogen in the body, the fibroids grow in size. As sometimes in pregnancy, your fibroids will grow in size because the estrogen amount is higher during that time. What are the tests that you will need once you have fibroids? So apart from hemoglobin, which tells us how much your bleeding is, and general tests we may order for either checking your health or planning a surgery, the tests of significance are ultrasound. Now this ultrasound can either be an abdominal ultrasound, which can pick up if there are large fibroids, or preferably a vaginal ultrasound. Since the vaginal flow is closer to the uterus, it tends to give a better clarity on the fibroids. Sometimes we may also order an MRI. MRI will tell the exact size, number, location of fibroids, and it also tells us about the morphology of fibroids. When we talk about morphology of fibroids, we mean that we want to know whether there is any cancerous element to your fibroid. Now, there is no need to panic. The incidence or the chance of having cancer in fibroids is very low. It is maybe less than 1 in 10,000, but still, once we are planning your surgery, we would like to know if there is any chance of any cancerous growth, because this will actually determine the type of surgery we plan for you. So for that we may require an MRI, which can give us some idea about the chance of having cancer in your fibroids. So all in all, I would say that a lot of women have fibroids. Once a diagnosis of fibroids is made, you do not need to panic. Rather, you need to consult your gynecologist who can advise treatment which is required for you. Remember, all fibroids need not be treated. All fibroids may not require surgery. Some of them may just require monitoring, and the chance of having cancer in the fibroids is very, very low. So shortly in the next video, I would be talking about the treatment of fibroids, and I expect that would be very helpful to all of you. Thank you.